And now let's move to the treatment. The treatment of the pneumonia including 3 steps: initial treatment, evaluation and adjustment, and finally termination of the treatment. Step 1. Initial treatment. It also includes 3 portions. Part 1. Treatment for the cause, that is, for the infection. Step 2. Treatment for the symptoms, including the fever, cough, sputum, and so on. Step 3. Treatment for the comorbidities, including the pleural effusion and so on. Let's look at the part 1, treatment for the cause. This table shows the recommendations of the initial therapeutic regimen for the mild pneumonia. If the patient got a mild CAP with young age and no comorbidities, we usually choose the penicillins, first generation of cephalosporin, quinolones, or microlides for these gram-positive bacteria and atypical pathogens mainly. But if the patient got a CAP with old age or with comorbidities or hospitalization, we usually choose other generations of the cephalosporin and other penicillins with beta-lactamase inhibitors, or combining using of these antibiotics to enhance the infection to the gram-negative bacteria. For the HAP patients, we usually choose some expensive drugs and combining using of these drugs to enhance the effect to the drug-resistant bacteria or fungus. The treatment for severe pneumonia is different from the mild pneumonia. The principles of the treatment for severe pneumonia include: in early phase, use the broad-spectrum antibiotics, full dose, and combination of the antibiotics. Here shows the recommendations for the severe pneumonia. But we must to notice here the recommendations of the therapeutic regimen for pneumonia will update every year. So we need further study of the guideline of the pneumonia. Here shows the introduction of each types of antibiotics. The most popular one is the beta-lactam, including several subtypes of the drugs: penicillins, cephalosporins, carbapenems, and so on, and other types of antibiotics include microlides, quinolones, and so on. Let's look at some important types of antibiotics. First one is the cephalosporin. There are 4 generations of cephalosporin. First, second, third, fourth generation of the cephalosporin. The antibacterial spectrum of the cephalosporin is broad for the gram-negative and positive bacteria, but all of the cephalosporins have no effect to the atypical pathogens. Now let's look at this figure. This figure shows the antibacterial activity of the cephalosporins to the gram-positive and gram-negative bacteria. From the first generation to the fourth generation, the antibacterial activity to the gram-negative bacteria is become more and more strong. But from the first generation to the third generation, the antibacterial activity to the gram-positive bacteria is decreasing. But the fourth generation present a stronger effect to the gram-positive bacteria than the third generation of the cephalosporin. About the adverse reactions, we need to focus on the renal toxicity. This adverse reaction is become less and less stronger, and the allergic reaction is not so real, especially in the patients with the allergic reaction of the penicillin. Another type of the antibiotics is the macrolides. The antibacterial spectrum of the macrolides is similar to penicillins, mainly in fact on the gram-positive bacteria, but the antibacterial infection of the macrolide is moderate or mild. But the macrolide can also be sensitive to the atypical pathogens. So we usually choose the penicillins plus the macrolides for the CAP patients with a suspicion of infected by the atypical pathogens. And about the adverse reaction, the hepatotoxicity of the macrolide is real. This page shows the information of the quinolones. There is a special subtype of quinolones called the respiratory quinolones, including the moxifloxacin and so on. These respiratory quinolones have a high concentration of the drug in the lungs. So we usually choose the respiratory quinolones for the infection in lungs. The antibacterial spectrum and antibacterial effection of the quinolones is similar to the third generation of the cephalosporins. The quinolones also belong to the second line of the antitubercular therapy because of the moderate effect to the tuberculosis. So, once a patient was diagnosed as a pneumonia with the suspicion of the tuberculosis, we'd better not to choose the quinolones for the initial anti-infective therapy for the patient. The quinolones also have well effect to the atypical pathogens, so we can also choose the quinolones singly for the initiate anti-infective therapy for the CAP. The adverse reactions of quinolones include hepatotoxicity toxicity, gastrointestinal reaction, central venous system symptoms, and so on. Aminoglycosides. This type of the antibiotics is rarely used for now because of the toxicity to the auditory nerve and kidneys. But these drugs still have a moderate effect on the gram-negative bacteria. So, in some cases, this drug can be added into the therapeutic regimen for the pneumonia patients. Those are the contents of the part 1, treatment for the course. Part 2, treatment for the symptoms. We know that the pneumonia patients usually get cough, sputum, and fever. Sometimes we'll get chest pain, dyspnea, and other symptoms. For the cough, we need to consider the necessity of the central antitussives seriously. If we use this drug for the patients with a large amount of sputum, the sputum will be hardly to coughed out, and in this condition, the sputum will obstruct the airway and finally results in the exacerbation of the infection and the risk of the apnea. So, for the patients with sputum, the expectorants is much more important than the central antitussives. If the patient got a fever, the NSAIDs can be used to control the temperature when the temperature is more than 38.5 centigrade. And if the patient got a chest pain, we can also dose the NSAIDs for the patient to control the pain. And if the patient got a dyspnea, the oxygen therapy is necessary. And sometimes we need a mechanical ventilation for the respiratory failure. So that's the part 2, treatment for the symptoms. Part 3, treatment for the comorbidities. For example, if a patient with a severe pneumonia combined with an infective shock, the rapid rehydration and vasopressors are necessary for this patient. And if a hematogenous spread systematic abscess occurred, the incision and drainage of the pus is necessary for this patient. And do not neglect to maintain the acid-base and electrolyte balance for the patients. Now that's the first step, the initiate therapy for the patient. Let's move to the step 2, evaluation and adjustment. Firstly, let's look at the question: when to start initial anti-infective therapy? I will give you 2 choices. A. To start initial anti-infective therapy as early as possible. B. To start therapy after we get the results of the sputum culture and blood culture. Which choice will you choose? A or B? Okay, the answer is A. we need to initiate anti-infective therapy as early as possible. Because we know that pneumonia is an infective disease, right? If we do not initiate anti-infective therapy as early as possible, the infection are likely to become more and more severe and finally will cause an infective shock. So, we need to start this therapy for the patient as early as possible, and it is required within 2 hours after diagnosis of pneumonia in China. So that's why I have another question. Why we need to evaluate the efficiency of the initial therapy? We just talked about that. We need to start the initial anti-infective therapy as early as possible. So, we just can choose the antibiotics according to the recommendations from the guideline because of the unknown microorganisms. In this condition, the antibiotics will be not working in some cases. So, we need to evaluate the efficacy of the initial therapy to do the adjustment in time. And this table shows the methods for the evaluation of the initial therapy. The first question: when to do this evaluation? We need to finish the evaluation within 48 to 72 hours after anti-infective therapy. And question 2: how to do this evaluation? We can do a review of the 5 diagnostic criteria of the pneumonia. And according to these criteria, we can finish the evaluation. If the patient got any following change of the diagnostic criteria, we can conclude that the antibiotics is working. 1. The sputum become less or thin, or the color of the sputum change from yellow to white. 2. The temperature become normal or decreasing. 3. The crackles decrease or disappear. 4. The white blood cell count become normal or nearly normal. And 5. The opacities in lumps decrease. This page shows when will the symptoms disappear. We need to remember these details for the patient information. Question 3. How to adjust? When we finish the evaluation of the effect of the antibiotics, we need to determine the further treatment for the patient. In one side, if the initial treatment failed, we need to find out the reasons from the following 3 aspects: pathogens, drugs, and host factors. We need to think about that, whether we do a correct estimation of the virulence and drug resistance of the pathogens, and choose a correct antibiotics for the patient. Whether the usage of the antibiotics is correct, including the correct dose, correct frequency, correct intervals, and correct infusion speed. Whether the patient is in a good condition of the nutrition and drainage of the sputum. If there is no problem in these three aspects, we need to think about the initial diagnosis of the pneumonia and think about other differential diagnoses. In the other side, if the patient have good response to the initiate treatment, we think that the initiate therapy can be keep continuing. Now let's move to the third step of the treatment, termination of the treatment. With a good response to the initiate anti-infective therapy, we need to think about that. When can we stop the therapy for this patient? For this question, the patients must meet the following two conditions. One is to get enough cost. Here shows the cost of the anti-infective therapy for the patient, but it is necessary for us to adjust the cost according to the symptoms for the individuals. 2. To fit the criteria of stopping antibiotics, including the normal temperature of the patient lasts for 2 or 3 days at least, and with a stable vital signs. If the patient meets these two conditions, we can consider to stop the therapy for this patient. Let's do a summary of the diagnosis and treatment for the pneumonia patient. Once a patient comes to our clinical room, we need to correct the information of the symptoms and signs during the inquisition and physical examination. And maybe the patient got a sputum, cough, and fever. In the physical examination, we can hear the crackles in lungs. In this condition, we can suspect a pneumonia. And next, we can arrange some auxiliary examination for this patient to confirm our initiate suspective diagnosis. That is the test of the white blood cell count and the radiologic examinations. According to the diagnostic criteria, we can confirm the diagnosis of the pneumonia. And next, we need to do an assessment for the microorganisms and severity and comorbidities of the pneumonia to complete our diagnosis. And next step, we can start our initiate treatment for this patient, including the treatment for the cause, that is the anti-infective therapy, and treatment for the symptoms, and finally treatment for the comorbidities. And after 2 or 3 days after the initiate treatment, we need to do an adjustment and evaluation for the initiate therapy. And finally, we need to determine when to stop the therapy for the patient. And that's the complete process of the diagnosis and treatment for a pneumonia patient. And now let's move to the virus types of pneumonia. This table shows the characteristics of the virus types of pneumonia according to the different pathogens. The first one is the Staphylococcal pneumonia, caused by the Staphylococcal aureus. The root of the infection is where the blood or inspiration. The symptoms of this type of the pneumonia include chills, high fever, purulent or blood sputum, dyspnea, and do not neglect the septic shock in the late stage. The signs is similar to the common pneumonia, and the radiological findings include some special findings different from the common pneumonia. Now, let's look at a picture. This picture shows the CT image of a Staphylococcal pneumonia. What can we find from this image? Yes, we can find this special change in this image. One is the air space opacity. Another is the nodules. And usually we can find the lung abscess here, caused by the Staphylococcal aureus. And this patient usually combined with a pyothorax. Here shows the purulent effusion in both lungs. And those are the special change during the radiologic examinations. And treatment for this type of the pneumonia usually include penicillin or first to second generations of cephalosporin and other antibiotics for these gram positive bacteria. Mycoplasmal pneumonia is caused by the Mycoplasma, which infected through the airway. The characteristics of this type of the pneumonia include significant dry cough and interstitial change or mass in both lungs. During the laboratory examinations, we usually can find the positive results of the IgM or fourfold increasing of IgG in the serum. According to these laboratory findings, we can confirm the infection of the Mycoplasma. The treatment for the Mycoplasma usually include macrolides and quinolones. Viral pneumonia. Lots of the virus can cause a viral pneumonia, including the H1N1, coronavirus, and so on. The route of infection is mainly through the airway. The characteristics of this viral pneumonia include high fever, dry cough, and usually with dyspnea in some severe cases. And most of the patients will combine with a secondary bacterial pneumonia. During the radiologic examinations, we usually can find interstitial changes in both lungs. And during the laboratory tests, we usually can find a positive result of IgM in the serum. And we can confirm the diagnosis of viral pneumonia according to the PCR result for the sputum. Usually, the patient will be with an increasing of AST, ALT, or CK because of the injury of the liver and muscles. For the treatment, the antiviral therapy is very important for this viral pneumonia. But in some types of the viral pneumonia, for example, the novel coronavirus pneumonia, we cannot find the antiviral therapy for them. So, the supporting therapy is also important for these viral pneumonia patients. Pulmonary aspergillosis is caused by the aspergillus, and the root of the infection is through the airway. There are two subtypes of the pulmonary aspergillosis. One is the invasive aspergillosis. That means the pneumonia caused by this fungus. And another one is the allergic bronchopulmonary aspergillosis. For short, is ABPA. And this subtype of the pulmonary aspergillosis is similar to the asthma caused by this fungus. Now let's look at some pictures. In this CT image, we can find a nodule in the right lung and some unclear opacity around this nodule. It's called Howler signs caused by the angioinvasion. And let's look at another picture. Here shows a fungal ball in the cavity, and we can also find a gap similar to the moon beside this fungal ball. It's called crescent signs. All of the nodules, Howler signs, and crescent signs will show a invasive aspergillosis. But in the ABPA, we cannot find these special signs, but we can only find the bronchiectasis or ring signs. There are other differences between the invasive aspergillosis. There are other differences between the invasive aspergillosis and ABPA from the table. You can learn by yourself. This page shows the Pneumocystis Carinii pneumonia. It's a very special infection, occurs in the patient with the immunodeficiency. For example, the HIV infection, or after using the immunosuppressors or glucocorticoids. So, it belongs to an opportunistic infection. The characteristics of the clinical manifestation include the severe dyspnea caused by the interstitial changes in both lungs, and we usually can find the fungal infection in tongues because of the immunodeficiency. And in the laboratory examinations, we can find the increasing of the G tests and positive results in the induced sputum smear. For this patient, we usually can find a decreasing of the pulse pressure of the oxygens or a type 1 respiratory failure. And the treatment for this infection include the TMP SMX or carbapenems. This page shows the lung abscess. There are some pathogens will cause lung abscess, and usually with a mixed infection. The root of the infection include through blood or inspiration, and the characteristics of the clinical manifestation is similar to common pneumonia, but the radiologic findings include the cavity and mass, as the picture showing. The treatment for the lung abscess is according to the pathogens, but once the infection spread to other organs, the incision or drainage for the pus is necessary. And now let's do a summary. Please focus on the contents of the two masks because it's very important for your exam or further clinical workers to mask the definition of the pneumonia, the clinical manifestation of the pneumonia. The diagnostic criteria of pneumonia is the most important contents in this class, and you need to keep in mind. You also need to remember the treatment of the pneumonia. Here shows the references for this class, and there are 2 guidelines for your further learning. If you are interested in it, you can download the files from the PubMed web. And this page shows the questions for your further learning. That's all for this class. Thank you.